It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the whack alternative medicine assets. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on the show without talking over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Don't forget Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And hey, I just did a new Normal World, and it was fun. It was on fecal transplant, and it was Thursday. It was the show from Thursday. What would that be? The 6th, June 6th.
Okay,
is that correct? And if you look in the on YouTube, it's youtube.com/@normalworld, or you can watch them on Blaze TV. In the description it says Dr. Steve, talks about fecal transplant, but the reaction that one got was my favorite.
Oh, really?
The first one, they were horrified, but this one, they were just laughing like school children.
So funny.
I put a couple of I don't want to ruin it for anybody. I put a couple of Easter eggs from our sort of universe in that one, particularly. So check it out. And it's also on our Patreon. It's linked directly from our Patreon. So, all right, check that out. Been having fun with the guys and the men and women at Normal World. It's really been a blast. And working with old Dave, he's a good, and I'll tell you that. All right, very good. What else? Tacey, you got a topic time? God, what is wrong with me today?
A couple of boring topics.
Okay, great. Well, that's a great teaser. Let's get on it.
It's Tacey's time of topics. A time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
Well, hello.
Hello.
It can't always be about penises. Sometimes we have to talk about testicles, too.
Excellent.
Excellent.
So Nick Cannon, father of 12, insures his testicles for $10 million.
What? Really? Now, doesn't he have like 14 kids or something?
12.
12. Okay, well, I guess he wants
Close
to have
enough. Yeah.
5 children with 5 different women in 2022.
All right.
Oh, my.
And this means that he can have the title of most valuable balls.
Well, okay, so I guess that's if he starts shooting blanks, then he gets paid from this.
Or maybe he gets.
I wonder what it's covered on.
Maybe there's
I don't know. I didn't read the article.
testicular
If I'm being
injury.
honest.
You didn't read the article?
No, I just got it. I just got it. Yeah.
Okay.
And I'm just going to be just saying the hell with it a lot during the show,
Uh-oh.
as I do not feel good.
Yeah.
So
Tacey's been sick for several days, and it's not COVID.
not COVID.
I think she's got whooping cough.
Uh-oh.
Oh.
Yeah. Oh, the 100-day cough.
Yep.
I've seen more of that bullshit. I even put on a tweet on that was, Carl always loves it when you go, well, I put on this great tweet. But I was talking about the clickbait idea of this 100-day cough. They just, COVID's over, so we got to have a different infectious disease that we need to shiver in our timbers about.
Right. Right on.
Shivering, that's not the correct saying.
Shiver me timbers.
Shimmer, but yeah, well,
or something like that.
Anyway, yeah, it is shiver me timbers. But anyway, we got something to make everybody terrified about. Another thing that they do is asteroid is hurtling toward Earth at 28,000, miles per hour or miles per second, warns NASA. Okay.
Mm-hmm.
So you go look at it And indeed, this is an asteroid that they know all about, that they've known about. They've been tracking it, and it came within 7 million kilometers of Earth.
Okay.
But when you read that title, it's hurtling
Mhm.
toward Earth
Yeah, it's gonna hit
at
us.
whatever velocity,
Yep.
warns NASA. You just know that that it's going to be the age of the death
Yep.
of the dinosaurs again.
Ugh.
It's pretty scary.
And then you go read the article, and it's nothing. It's just
No.
crickets.
Yep.
I
just
have
the way-
another scary article.
Whoa.
Okay, yeah, read it.
U.S. doctors probing if COVID is to blame for unusual spike in cancer after pandemic.
Oh boy, here we go.
Oh,
I'm going to say let me just predict this before you say anything.
Whatever you do it for less at Harbor Freight.
We're having an uptick, maybe statistically significant uptick in certain preventable cancers. That's going to be my guess.
They
But go
actually
ahead, Tess.
talk about that in the article.
Oh, that's one
about
you actually
how,
read. Okay.
Some medical experts have pinned the trend on healthcare disruptions,
Right.
including hospitals having to turn away cancer patients and those who didn't get diagnosed early enough amid fears of the virus.
Well, sure. I mean, they weren't doing colonoscopies because they were afraid that, I guess aerosolized ass juice would
Yep.
be contagious. I mean, when nobody knew what the hell was going on back then.
no.
They are also, however, calling on the federal government to prioritize the research.
On. So what are they saying? If it isn't that, what are they thinking it is?
Well, I don't know. It says that they are completely under investigating the virus.
Sane people act.
I'm sorry.
And yeah, just kick a woman when she's down.
That's right. She's hurting, Steve. She's
This
hurting.
is not how sane people act.
I don't give a shit. So, how
Did it say what kind of cancers had gone up? Or
no.
This is Tacey.
I don't care. I don't care. My jokes don't go over. I don't care. I don't care.
They're just wondering if COVID affected the cell energy production and cancer vulnerability.
Okay. Well, that's
would
interesting.
be interesting. Yeah.
That is interesting. And
So-
and also the vaccine, I would assume.
Alternate studies from other doctors are sequencing the gene profiles of cancer patients who died of COVID, as well as if the virus can reawaken dormant cancer cells in mice.
Wow. Well, ain't that something?
Ain't that something?
So the research comes after a new study suggested COVID vaccines could be partly to blame for a rise in unprecedented excess deaths in the U.S. and other Western countries.
Yeah.
So, I mean, they're not saying anything. They're just
Yeah.
throwing it out there.
Yeah. Trying to get
Stir up
another
Stir some
headline.
shit.
Stir up some shit.
Well, we'll see
man.
when we get some studies that show a statistically significant difference in those cohorts.
Mhm.
I'll be very interested in knowing what the mechanism is.
I still will take a vaccine any day that one is offered to me.
Well.
However,
Well, I've had it twice. I've been vaccinated 3 times. I had COVID twice. And the first time it took out 1/8 of my lung.
Yep.
So I'm going to have to think hard about that next time.
Yeah, it's
We'll
pretty
see.
crappy.
Yeah, we'll see.
I like getting shots.
I like natural immunity, but I understand that things mutate and like
Mhm.
influenza, but that's a traditional vaccine.
Mhm.
I'm just, I'm just being slightly more cautious with a vaccine that hasn't been approved by the FDA.
Mhm.
It's still under emergency authorization. It's been 4 years now that we've
Yeah, at
been
least.
dealing with this virus.
Yeah.
And why and also we don't vaccinate for all the other coronaviruses, and they ace a certain number of vulnerable people. I was on Gino Bisconti's show, and when I said there's 5 other coronaviruses back in the day,
Mhm.
they would kill 20,000 people a year, maybe more. We just didn't know. We called them atypical. And he made the point it was all the vulnerable elderly or people on chemo or people with immunocompromised, stuff like that. He was right.
Mhm.
It was not young and healthy people
As a general
that
rule,
succumb to coronaviruses for the most part. Influenza, different story.
Hmm.
And I did point out to him that in 1918, that particular virus targeted the young,
Mhm.
and so younger people were more vulnerable than older people were. And also this swine flu epidemic that passed through here, and what was that, 2008, something like that.
Yeah, I think so.
That's the one that took out Barry the Blade, our beloved chatter,
Mhm.
who gave us the trucker duty bit, and also Richard David Smith, the owner of Hyperphysics, HYPERFIZZICS.com. Check him out as energy drink for nerds. But it almost took him out.
Mhm.
Both of them, I don't know about Barry the Blade, but I know that Richard was unvaccinated. But I sailed through that.
Mhm.
Why? Because I was exposed to swine flu in the 70s
Gotcha.
during the Carter years, when we first heard about Guillain-Barré
Ugh.
from people who were getting the vaccine, or people who were getting influenza that year.
Mm.
So Guillain-Barré being ascending neuritis, and want to just throw a jargon out there without explaining it, where people have loss of nerve function starting in the feet and working their way up. And if it gets all the way up to the chest area, it affects the breathing muscles,
Right.
and you end up on the ventilator. Now, very often it will descend, but some people are left with permanent deficits
Right.
from that.
Yes.
But I remember that. And so when that swine flu came through, the elderly, like me,
Mhm.
tended to be relatively protected from that one.
Mhm.
So it is different from virus to virus, but in general, the coronaviruses are more deadly to the elderly
Mhm.
and infirm. But
Right.
anyway,
Yeah,
all right.
makes sense.
And you're going to see a whole lot of stuff going forward, because we never used to test for that. If someone had atypical pneumonia, we didn't have a treatment for it, right?
Mhm.
We'd call it viral pneumonia, and many of them were coronaviruses, as I said. And so we never tested for it. So we just called it that. It was just a clinical diagnosis. We knew they didn't have a bacteria. Nothing grew out of their sputum, so it must have been virus. Now we're testing for all these. We're even testing for rhinovirus, which is just a regular old, run-of-the-mill cold virus.
Right.
So we have these viral respiratory panels now, which we never had before.
Huh.
We used to just test for influenza A and B.
Right.
And then we were testing for influenza A and B, respiratory syncytial virus,
RC, yep.
and which causes croup in children,
Mhm.
and then COVID-19.
Gotcha.
And now we have these panels that look at adenoviruses, picornaviruses,
Mhm.
rhinovirus, all this stuff. It's crazy. And you get this list of like 20 things. So now that we're testing for them, why can't we just now work on killing them?
Well, and that's what I was going to say too, Dr. Steve. The interesting thing about that is we test for all these, but there aren't a whole lot of
No, there's
great
no treatment
treatments.
for it.
Yeah, there's no
Yeah.
treatments for it.
Yeah, for
So,
most of them.
Well, yeah, that's
Yeah.
what
Yeah, zinc has been shown in some decent studies to decrease the duration of a cold
Mhm.
by about a third.
Mhm.
So the
Should've
zinc
done that.
lozenges, huh?
Should have done that.
Yeah.
Elderberry.
Don't ever do the zinc nasal spray,
Yeah, yeah.
because that actually caused anosmia in some people. That's why it got taken off the market. The inability to smell.
Right.
But the zinc lozenges are fine. Hell, if you get a cold, it's not going to hurt anything.
No.
So what were you saying about elderberry? There are actually studies
There are
on
some
that.
decent. There are some decent
Are
studies.
there?
On
Okay, now I'm gonna
elderberry.
look it
Yep.
up.
Oh yeah.
Okay.
That helps shorten the duration of viral infections if taken early enough.
Right.
Another thing is to wash out your stupid sinuses with some nasal sprays.
Correct.
And that is legit.
I
The
did
other-
the
the-
Navage today.
But you didn't use your Simply Herbals nasal
No,
spray.
because I don't
Don't
have
any.
one.
I know. I gotta
Scott.
bring you some. And the other thing is they say you can gargle salt
Steve
water.
hogs all that.
I have some for you.
Yeah.
So he's right. Any viral particle that you wash out of your nose that the body doesn't have to activate some mechanism to do will make you feel better.
Sure helps.
Because a lot of what makes you feel bad about the cold isn't the virus invading, it's your body's response to it.
Right. The sphenic flare.
So Tacey used the Navage. Dr. Scott, we didn't mention I don't know if we mentioned your website, but it's simplyherbals.net.
Mhm.
He has sinus rinses there, and one of them's got CBD in it, and it's quite delightful.
Love it.
Here's elderberry for prevention and treatment of viral respiratory illness. Now, this is in the British medical something of complementary medical therapy. So this one is it's a biased journal, but that's okay. It says elderberry may be a safe option for treating viral respiratory illnesses. There's no evidence that it overstimulates the immune system. Well, okay, I wasn't asking that. However, the evidence on both benefits and harms is uncertain, and information from recent ongoing studies is necessary to make firm conclusions. So they screened 1,187 records and 5 randomized trials for elderberry for the treatment or prevention of viral respiratory illness. And so they really just didn't find, okay, here we go. We found evidence that elderberry has some effect on inflammatory markers, although this effect may decline with ongoing supplementation. So it's, I'm
Maybe not.
I don't think, for me, that this is a pretty, and this is in a journal that would be biased toward
Oh,
a
really? Okay.
complementary therapy, right?
Gotcha.
It's the British Medical Journal of Complementary Medical Therapies. But
Gotcha.
and I appreciate them being forthright about this.
Sure.
The evidence for me isn't strong enough to
there.
recommend it.
Gotcha.
Dr. Scott can recommend it, and it's probably tasty.
It's lovely, actually.
Yeah.
It's got a nice flavor.
Yeah.
Won't
There you
hurt
go.
nothing.
Won't hurt
Yeah,
you.
probably won't hurt nothing.
Won't hurt nothing.
Well, get you some little corn squeeze and some rocks. No. Wait, what is it? Rock candy.
Rock
And a
candy.
little
Rock candy.
And a hippie. All right.
That
Now here's
stuff does help.
here's one. This is from Complementary Therapeutics in Medicine. This is a meta-analysis. Black elderberry supplementation effectively treats upper respiratory symptoms. So this is they're looking at symptoms, not necessarily duration of illness. So,
Gotcha.
So
Maybe make you feel just a hair better.
But it says these findings present an alternative to antibiotic misuse for upper respiratory symptoms. This is one of the problems. Doctors and nurse practitioners, PAs, all have this problem. Is somebody comes to you and they've got a cold. They've paid money for the visit. You kind of hate to send them out there without anything. And now there are some docs that just go, "You got a virus, get the hell out of here."
Right.
And by the way, pay your bill on the way out.
Right.
But I think that you need to take time to walk people through all the things that we talked about. And then at least they feel like they've got some value. And if black elderberry supplementation treats the symptoms, hey, here you go.
Yep.
Or you could sell it out of your office like Dr. Scott does.
Yes, you can.
You don't sell elderberry though. I've never seen that.
No, I don't
You
have.
sell
I don't
your
have that.
Chinese.
No, we've got other herbs for cold.
Now, tell me this: you are licensed to compound
Correct.
certain things, right? But what's the limits of that? Could you compound black elderberry in your office and sell it?
Absolutely. Any kind of nutraceutical.
Yeah.
Any kind of
So as
herb.
long as it's legal over the counter,
Right. If it's legal, I can't do any pharmaceutical prescription stuff.
Right.
But anything else, if I decide to make an herbal tea for sinuses,
Yeah.
then, I can literally make anything. When I was in school,
but I can't do that because I'm not licensed.
Yeah.
Because you're licensed.
I am licensed in.
right?
I'm licensed in herbal medicine. Yeah. I've got a national a license in Chinese herbal medicine. Yeah. I don't know. I would assume you can.
Well, then what
It's
good
on-
is it getting the license? I mean, besides the fact that you know what to do,
Right.
though. But
Right.
I mean, does it give you a differential advantage? Like, oh, you can only get this certain thing from me.
To a certain degree, it does. Yeah. Yeah. Especially the herbs that we use in our office. You have to have a license to buy them. And then they're
So it's
supposed
that
to.
guild mentality.
Yes,
You've got
exactly.
a place that will only sell to people who
Right.
did the certain.
Legitimate.
Yeah, okay, I got it.
Legitimate herbs.
Got it,
Yeah,
got
from
it. Well,
legitimate companies.
I got you.
Yeah.